Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County. And today we're going to talk about new cases of COVID and what you should do if you happen to get it. So, as you may know, Omicron surge is very high, and there are a lot of cases of disease in Oregon. Douglas County is just starting with a big surge, but we think over the next 3 weeks, there are going to be thousands and thousands of people in Douglas County who have disease. The good news is that overall, Omicron seems to be less serious than other forms of COVID. And most of the people who have COVID in this surge are going to get it, be moderately sick for a few days, and then get over it. There are going to be just a small number of people who we think are going to be very seriously ill, that are going to need medical attention, maybe need hospitalization. And we want to be sure that we can take care of everyone. So, during this whole pandemic used to test lots of people for disease. And the reason we did that is we would find a disease in an area, a school or a business or a house, and then we would try and contain it in that area. So one of the biggest reasons we asked people to get tested was to help us contain the disease. Well, at this point, we don't think there's anything that we or anybody else could do to contain the disease. And so the recommendations for testing have changed. Right now, the only people that we would recommend that get tested are people who think they have COVID and think they need medical attention. So if you think you have COVID and you're having troubles breathing, if you think you have COVID and have troubles eating, if you have COVID and you're having troubles walking where you previously could walk, then you really need to call your doctor. And those are the people that should get tested. If you're just mildly ill, there's no real reason to go in and get tested. A couple of reasons. One is it's not going to be able to change our ability to go ahead and control the disease. It's not going to change what we would do for you, because we're still going to be asking you to stay home until you're well. And it's really not going to change how we would treat you, because for most people, no treatment is available or even necessary. If you do have a home test, if you have symptoms and have a home test, that would be the ideal time to use it. But again, it's not really going to change much of what we do during this time. Now, we will get to a time later on when the number of cases go down, and then we will want to test everybody with symptoms. But for right now, with the disease so widespread as it is in Douglas County and Oregon and the U.S., we're really changing our testing recommendations. So again, you do need to get tested if you think you have COVID and you have severe symptoms needing medical attention. You do not need to get tested if you have mild symptoms. You do not need to get tested if you're a contact of the case in a usual situation. The only exception to that is if you're a contact of the case and work in a high-risk area like a nursing home or hospital, your employer may want you to get tested before you come back to work. So let's say you either have symptoms of COVID, been in contact of somebody with COVID and you have symptoms, or you're one of those people who test positive on a home test or other. What should you do? Well, the thing that you should really do is try not to spread it to others. And by not spreading it to others, that means you should isolate yourself. The best way to do that is to stay home. If you're the only one sick at home, you should stay by yourself. If everybody's sick, you can stay together. You should stay home. You should try and limit the amount of times that you go out. You should try and limit the number of people who you see. And how long should you do this? Well, previously we used to say 10 days. The new recommendation is at least 5 days. And then until your fever is gone for 24 hours without using Tylenol or ibuprofen, and your symptoms are getting markedly better. So what we've seen in COVID is that symptoms go up and down. So if you're a little bit better than yesterday, that's not markedly improved. You really need to be either totally symptom-free or much better than you were a day or two before. So again, if you think you've been exposed, if you think you've been exposed or somebody else in the family has it, stay home for 5 days plus until you're feeling markedly better and your fever is gone. Now, in the past, we used to get every case, contact every case, and call everybody every day. And we could do that when we had 10 or 20 cases a day. But yesterday, we had 200 cases, and we think by the end of the month, we may have as many as 500 cases a day, and thus it's impossible to call everybody. So if you are positive and have questions, call our hotline, 541-464-5660. And they'll be able to help you with questions that you have. We have epidemiologists who are answering the call every day. In addition, we have contacts with all of the big clinics in town, and Uncle Health Alliance has agreed that if you don't have a doctor, you're from out of town or have questions, that their case managers will help with the things that you need. And some people will need help. Right? If you do need to stay home for 5 days, some people may need help with food. They may need help with other things. So again, you can call our hotline at 541-464-6550. What about notifying contacts? So you get the disease, you were at work yesterday or somewhere else. In the past, Douglas Public Health Network epidemiologists would contact them. But again, with this many cases, we are certainly not going to get to everyone. So if you have a case, you were likely contagious for 2 days before you had your first symptoms. So if your symptoms show up on Wednesday, you were likely contagious on Monday and Tuesday, and you might contact the people that you saw on Monday and Tuesday and say, oh, bad news. I know we went to lunch together on Monday, and on Wednesday I tested positive, in which case that person is a contact. If that person is a contact and they're fully vaccinated and boosted, they don't need to do anything else other than monitor their symptoms. If they're not fully vaccinated and boosted, they really should stay home for 5 days to be sure that they're not going to come down with the disease. We see the incubation period on this is about 3 days. So again, if you're positive on Wednesday and call them on Monday, you're likely getting them before they would get the disease, and then they can stay home and then not infect others. We think through this, there are going to be a lot of people in Douglas County who get sick with this. The good news we're hoping is that not as many people will get quite as sick as they did before, but we do worry, and we worry a lot, that our hospitals will get overwhelmed. If we have 500 cases a day, and even a quarter of those people show up at the hospital, there is no way in the world the emergency room can handle that number of patients. So what we're asking is, if you are at home and you're sick, you do not need to go get tested. You certainly don't need to go to the emergency department to get tested. You should only wind up looking for medical care if you have COVID and have difficulty breathing, difficulty eating, or difficulty walking where you previously could walk well before. This is going to be a tough time. You know, we have talked about public health being like the weatherman. We can tell you what's out there, and we can tell you how to prepare, but we really can't change the course of the pandemic, just like you can't change the course of the weather. It's going to be a stormy 3 or 4 weeks. So get ready, prepare for it, and recognize all bad weather goes away. And similarly, this peak will go away, but probably not for another month or so. So take care. And if you do have questions, give us a call at our hotline at 541-464-6550. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Thank you.